Hi, this is Kimberly Brown, and I'm doing this assignment for Module 6, Assignment 1 of the SBAR video for Nursing Foundation with Dr. Cheek. So to start, I am to read the scenario. So scenario number 1, Mr. O is 63 years old. He was dizzy and lightheaded at home and almost fell. His wife brought him by car to the ER. Mr. O was admitted to the AMU with syncope. This is not the first time that Mr. O has been admitted to the hospital. He has been treated in the past for congested heart failure and acute myocardial infarction. He feels like he's pretty healthy as he only takes NSAIDs at home for chronic back pain. Mr. O got to the AMU at 1600 hours. His nurse, Jenny RN. Jenny RN assessed him and found his blood pressure to be 138/84. The pulse is 76 and regular. His respiration rate is 16. He's afebrile at 98.6. Mr. O's labs were normal, but his IV infiltrated during transport. Jenny RN started a new IV and put a warm compress on the O site. Jenny RN reported off to Ben RN at 1900 hours. At 2130, the PCA found Ben RN and told him he had just helped Mr. O off the bedpan. Mr. O had a large black tarry stool and was complaining of not feeling well. Ben RN went in to assess Mr. O. His vitals were blood pressure 94/66, pulse 114, respiration 24, and his pulse ox was 97%. He was pale and his skin was clammy. Ben RN asked him how he was feeling. Mr. O said he just didn't feel well and could not get comfortable. He asked if he could have something for his belly. It really hurts. Ben RN assessed his abdomen and found that it was distended and Mr. O had diffuse abdominal pain. He rated his pain on a 6 on a scale of 1 to 10. The SBAR definition. The SBAR is a method of communication used by healthcare providers. The SBAR communication tool provides a standard way that healthcare providers communicate with each other to share specific healthcare information during handoff situations. Having a situational awareness is essential in providing good patient outcomes. In the hospital setting, most of the communication related to patients occur between doctors and nurses. The Joint Commission Agency for Healthcare Research and Quality, the Institute for Healthcare Improvement, and the World Health Organization recognize SBAR as an effective communication tool for patient handoffs. SBAR is an acronym for Situation, Background, Assessment, Recommendation. Situation. Introducing yourself and explaining the situation of why you are contacting or communicating with the physician. The background. Provide background information about the patient. Assessment. Provide an assessment of what you think is going on with the patient. Recommendation. Your recommendation of what you think you should be done for the patient. In the next clip, you will see a SBAR in action.
Hello.
Hello, Dr. Hilbert.
Yes, this is he.
Hi, this is
Hi.
Nurse Brown, Kimberly Brown. I'm working at Lincoln Memorial Hospital on Ward 2. Scenario 1 was chosen for the focus for the SBAR. The SBAR, the situation I'm calling about is Mr. O is a patient at the AMU in room 3. The PCA reported that Mr. O had a large black tarry stool in his bedpan and is also complaining of not feeling well. Mr. O's skin is pale and clammy. He has abdominal distension and is complaining of abdominal pain of a 6 on the 1 to 10 scale. The background. Mr. O is a 63-year-old male. He was brought to the ER by his wife because he was feeling dizzy and was lightheaded and he almost fell. At 1600 hours, Mr. O was admitted to the AMU with syncope. This is not his first time at the hospital. He had previous visits at the hospital for congestive heart failure and acute myocardial infarction. He uses NSAIDs for chronic back pain as well. Upon admission to the AMU, an IV was started, and his vitals were blood pressure 138/84, pulse is 76, his respiration was 16, his afebrile at 98.6, and all of his labs were within normal range. Now at 21:30 hours, his vital signs are 94/66 for blood pressure, pulse rate is 114, respiration is 24, and his pulse rate is 97. Upon assessment, Mr. O has signs of internal bleeding with acute abdominal pain and abdominal distension. Recommendation: order MRI or abdominal ultrasound to determine the cause of the bleeding and the abdominal distension, run a CBC to rule out infection and anemia, or CMP, to determine liver kidney function and electrolyte balance, and we need to order a stool test to confirm or rule out blood being in his stool. Any questions?
No. Is there anything else?
There's one other thing. We were also wanting to recommend a medication, morphine, to help with and reduce the abdominal pain, and possibly an antacid to help reduce the gas and bloating.
Okay. Sounds good.
Okay.
Go ahead and take care of that.
Thank you very much, Dr. Hilbert.
You're welcome.
Hi, so thoughts on the scenario? Well, I thought the scenario was hard to read and hard to understand. It seemed to be too many unnecessary words and not enough pertinent information. The finding terms should be added for the acronym AMU. Other issues was stated that the wife brought him to the ER, but it also stated that the IV infiltrated during transport, so not sure transport from where, from the ER to the AMU. However, this does seem like it's an emergency situation due to possible internal bleeding and the change in Mr. O's vital signs. On another note, the fact that Mr. O feels that he's pretty healthy and has congested heart failure and acute myocardial infarction is interesting and might need to be further investigated by mental eval. However, the situation does appear to be an appropriate situation to call the physician and to advise of Mr. O's status. What could be added to the SBAR? Information pertaining to the NSAID use, the type of NSAIDs, how often he used them, the doses he was taking. Other information to include would be the type of tests that were run, the type of IV that was given, how long was the IV infiltrated in Mr. O's arm, and what was Mr. O's temperature when taking vitals the second time. Not needed in the SBAR was the fact that the IV infiltrated during transport, that a warm compress was put on the site of infiltration, the names of the nurses and that they changed shifts, that the stool was found by the PCA and that the PCA reported to the nurse. Different conversation with improvements. Information including the types of labs that were run initially would be included. The temperature would be added to the second vital signs. The timing and the type of IV would be included. The types of NSAIDs, doses, and frequency would be included. We will leave out the names and shift changes of the nurses and the PCA. That would improve communication as well. Lastly, the mention of Mr. O's mental state might also be included with further investigation. Significance clearly presented to the physician. I do not believe the full significance of the situation was presented to the physician. If the communication would have included the information about the second temperature, the types of labs already run, the type of NSAID, their doses, the frequency that they were taken, the type of IV, how long was the IV run, was there any swelling of the hands and feet? This additional information would have helped formulate or rule out possible diagnosis. However, I do believe that the situation warrants concern and follow-up with the physician. Thank you very much.